Good day, everyone, and welcome to our new lesson for today in Health 8 for the second quarter, Module 8. So this lesson is all about Unang Yakap, Essential Newborn Protocol. Bakit nga ba ito tinawag na Unang Yakap? Okay? So pag-uusapan natin ngayon ang patungkol sa Essential Newborn Protocol. Okay, so after going through this module, you are expected to discuss the essential newborn protocol o tinatawag nating unang yakap and initiation of breastfeeding. Now, after this lesson, the student should describe how to give essential newborn care, explain how to assess, classify the different illnesses of newborn babies, and to recognize the advantages of breastfeeding. Alright, the most important outcome of Unang Yakap is the promotion of breastfeeding. Since the baby is placed closely to the mother's breast, he becomes familiar with the breast as the source of food. Ngayon, pag-uusapan natin, ano po ba yung unang yakap na yan? Actually, ito ay tumatalakay sa mga prosesong ginagawa during the or after giving birth by the mother to her child, no? Ano ba yung ginagawa pagkatapos manganak ng isang babae? So, ito yung tinatawag nilang unang yakap. Okay? So, ang unang yakap emphasizes the need to breastfeed within the first 60 to 90 minutes because it is during the early stage of breastfeeding when the protein and nutrient rich colostrum is released. Ano po ba yung colostrum na yan? So mamaya pag-uusapan natin what is colostrum. So this gives the newborn baby protection against the infection. So napakahalaga ng colostrum o unang pag-inom or pagsuson ng sanggol sa kanyang ina dahil ito ay nagbibigay ng proteksyon, no, sa sanggol against infection. So, unang yakap essential newborn care protocol for new life. Actually, ito po ay nahati sa dalawa, no? So, mamaya pag-uusapan natin ano ba yung dalawa na yon. Ano nga ba yung unang yakap? Pag sinabi nating unang yakap, it saves life of mother and newborn. Again, unang yakap saves life of mother and the newborn or the baby. So it is the campaign for all practitioners and health facilities to adopt and embrace the safe and quality care of essential intrapartum. So essential newborn care or ENC is a care that every newborn baby needs regardless of where it is born or regardless of its size. So ang essential newborn care should be applied immediately after baby is born and continued for at least the first 7 days after birth. So kailangan mahigpit na ipinapatupad ang essential newborn care mula sa oras na ito ay isinilang hanggang sa ikapitong araw pagkatapos nitong isilang. So, essential newborn care protocol, sinabi ko na kanina, it aimed to significantly reduce infant deaths in the country. So, yung guidelines nila, inahati po sa dalawa. So, number 1 is the time-bound and non-time-bound. Nahati daw po sa ilan? Very good, sa dalawa. At ito ay una, time-bound. Ano po ulit? Very good, time-bound. At pangalawa ay non-time-bound. Ano po yung pangalawa? Non-time-bound. Very good. Plus the unnecessary procedures. So let's proceed first for the time-bound procedures. Time-bound procedures should be routinely performed. First, which are, diba halimbawa, yung sanggol ay ipinanganak na o lumabas na sa sinapupunan ng nanay. So, ang unang step ay immediate drying skin, no? So, patutuyuin syempre muna yung bata gamit ng malinis na tuwalya. So, hindi siya pwedeng hugasan kasi baka magkaroon ng infection or hypothermia. So, pinupunasan lang ito, no, ng mga nurse o kung sino man yung nagpaanak doon sa nanay. And second, we'll have skin-to-skin contact kung saan yung sanggol ay ipapatong sa dibdib ng nanay para magkaroon sila ng skin-to-skin contact, no, para mapanatili yung mainit na temperatura ng sanggol and also a bonding of a mother and a child na din. So, secondly, clamping of the cord. After 1 to 3 minutes, hindi siya pagkapanganak, pinuputol ka agad. So, there is a proper protocol to do that. So, non-separation of the newborn from the mother. Hindi mo na siya tatanggalin hanggang sa matapos na yung tapat na procedure right after giving birth ng nanay. And of course, dito din magkakaroon ng breastfeeding initiation ang sanggol. Kung saan, syempre, di ba yung nanay ay wala pang saplot, wala pang suot, kasi nga meron silang skin-to-skin contact ng sanggol. Kapag yung sanggol ay naglikot na, tumatadyak na, kumakapa na, hanggang sa makapa niya na yung suso ng kanyang nanay, magkakaroon na yan ng breastfeeding initiation or ito ay sumisimbolo na that the baby is now ready to have breastfeed, no? So sa non-time-bound interventions naman, ito ay ang mga pagbibigay ng immunizations, bakuna ng mga doktor, pagbibigay ng vitamin K, ito na yung tinitimbang na yung bata, ayan na right after, if I'm not mistaken, 6 to 7 hours, ayan, pwede na siyang hugasan, and routine suctioning, yung pagkakaroon na ng routine sa pag-dede or pagsuso, a routine separation of newborn for observation, and administration of pre-lactals. Okay, so those are the non-time bound. All right, next. Newborn screening is a simple procedure to find out if the baby has congenital metabolic disorder that may lead to mental retardation or even death if left untreated. So, napakahalaga po na magkaroon ng newborn screening para habang sanggol pa lang ay nalalaman na kaagad kung meron bang problema ang bata. So, that kailangan magkaroon nga ng non-time-bound activity sa mga sanggol, no? So that is what we call, number 1 is newborn screening. That is, again, a simple procedure to find out if the baby has congenital metabolic disorder na maaaring magresulta sa mental retardation or even pagkamatay ng sanggol kapag hindi ito naagapan kaagad. So, next, we have resuscitation of a baby na hindi humihinga, no? Pagkalabas pa lang sa kanya. So, binibigyan sila ng resuscitation. No? Next is colostrum. Colostrum is mentioned earlier. So, it is actually a milk-like fluid, no, released from the breastfeed of the mother after they have given birth. So, rich in antibodies and helps the newborn's immature digestive tract develop. So, halaga ng colostrum sa sanggol dahil nagbibigay ito ng antibodies. Katulad nga ng sinabi kanina ay pinoprotektahan nito ang sanggol sa iba't ibang infection. Next is immunoglobulin. It is any of a class of proteins present in the serum and cells of the immune system which function as antibodies. So, lactation is the period of milk production initiated by the prolactin hormone in the mammary gland, while the oxytocin naman is a hormone released by the pituitary gland that causes increased contraction of the uterus during labor and actually stimulates the ejection of milk into the ducts of the breast. So, that is what we call oxytocin. Now, let's proceed. What is the IENC protocol? So, sir, ano po ba ang IENC? Okay, ang EINC ay Essential Intrapartum Newborn Care. Actually, that is a protocol, a series of measures that are performed in order to provide a safe and quality care for mothers within 48 hours of giving birth and up to a week of a newborn's life. So, kumbaga parang yung o yung nanay, matapos niyang manganak ay sumasailalim siya into measures or into some observations, no, para sa safety and quality care for the mothers na binibigay within 48 hours matapos manganak hanggang sa linggo, no, ng kanyang a week after ng kanyang panganganak. So next, first, the newborn is immediately and thoroughly dried. No? Katulad nga na sinabi ko kanina, pagkapanganak ng sanggol, pagkalabas sa sinapupunan, ayan, pinatutuyo ang bata. So this step stimulates the newborn's breathing. Alright, second is the newborn and the mother must come into a physical contact with each other for at least 6 hours. That is what we call Unang Yakap. No? So this is done to prevent complications such as hypothermia, katulad na sinabi ko kanina, infection, and hypoglycemia. Okay? Next, the third is the umbilical cord of a newborn is clamped, iniipit muna, for 1 to 3 minutes or when the cord pulsations stop, okay? The proper timing of umbilical cord cutting and clamping helps prevent a newborn's brain from bursting a blood vessel and bleeding. Hindi din kaagad-agad pagkapanganak pinuputol yung pusod, no, sa Tagalog, or umbilical cord nga sa English, no. Meron silang protocol na sinusunod, oras para putulin ito, no. Ayun nga, una nilalagyan ito ng ipit for about 1 to 3 minutes or they are waiting to stop the pulsation of the umbilical cord bago ito gupitin, para po maiwasan yung newborn's brain from bursting a blood vessel and pagkaroon din ng bleeding. So, ayun yung iniiwasan natin. Kaya, we need to follow this protocol. Fourth, the mother and her newborn are kept close and early breastfeeding is implemented. Ayan, during the unang yakap. Early breastfeeding gives a newborn a substance called colostrum. Ayan. So, which boosts a newborn's immunity against diseases. So, unang yakap is an improvement on prenatal care. Also promotes respectful birthing because it gives the mother the option to choose who she wants to be with as she gives birth. Actually, the mother is mobile and within reason during labor. She is also able to choose her position during labor and delivery. The mother is given a non-drug pain relief before offering anesthesia. So there is a spontaneous pushing in semi-upright positions. So there is no episiotomy unless necessary. There is active management of third stage labor and use of partograph in labor monitoring. Most health centers and hospitals now perform this protocol on newborns prior to giving birth. You can give clear instructions that you want to perform. Unang yakap is immediately after your baby is born. Alright, so tatalakayin naman natin ngayon si slides na to, yung 4 na paraan kung paano magkakaroon ng loss of heat, no, sa mga sanggol. Number 1 is evaporation. Yung evaporation na to sa sanggol when amniotic fluid evaporates from the skin. But before that, what is amniotic? Actually, amniotic fluid is the protective liquid contained by the amniotic sac of gravid amniote. So this fluid serves as cushion for the growing fetus, but also serves to facilitate the exchange of nutrients, water, and biochemical products between the mother and the fetus. So since dahil nga newborn na siya, so wala na siya sa loob na sinapupunan, the amniotic fluid ay nag-evaporate sa katawan ng sanggol. So one way ng pagkakaroon ng losses of heat sa katawan ng sanggol. The second one is conduction. When the baby is placed naked on a cooler surface such as the floor, table, weighing scales, cold bed. So, dapat hindi nakahubad yung sanggol para maiwasan yung conduction. Next is convection. Convection when the baby is exposed to cool surrounding air, a draught from open doors and windows or a fan. No? So, direktang nahanginan yung bata. So, that is what we call convection. And lastly, the radiation when the baby is near cool objects, walls, tables, cabinets without actually being in a contact with them. So those are the newborn loses heat in 4 ways. Okay? All right, now let's talk about breast milk. So breast milk is the milk produced by the breast of a human female to feed a child. So alam naman natin yan, di ba? Kaya nga meron tayong tinatawag na breastfeeding. So later on, we'll talk about breastfeeding. So milk is the primary source of nutrition for newborns. Sino ba dito yung nanay na nagpakain ng chichirya sa anak? Syempre wala, di ba? So before they are able to eat, digest other food. So milk lang muna. So breastfeeding, nasabi ko kanina, lowers your baby's risk of having asthma or allergies. Babies who are breastfed exclusively for the first 6 months without any formula have fewer ear infections, respiratory illnesses, and bouts of diarrhea. So breastfeeding has been linked to higher IQ scores in later childhood. So may mga scientific basis na ang mga bata na nag-undergo ng breastfeeding for about from birth to 6 months ay mas mataas daw yung IQ scores nila in a later childhood. So, ano ba yung mga benefits ng breastfeeding for both mom and baby? Number 1, breast milk provides ideal nutrition for babies. No? So, dahil nga hindi pa sila nakakakain ng mga solid food, ayan. So, ang pinakatamang pagkain sa kanila ay gatas ng ina. So, breast milk loaded with antibodies that help your baby fight off viruses and bacteria. Imagine the breast milk is has antibodies na, no? Kumbaga, parang complete package na for the baby, iinumin na lang para maprotektahan yung sanggol laban sa mga viruses and bacteria. Number 3, breastfeeding may reduce disease risk. Number 4, breast milk promotes a healthy weight. So, mapapansin natin, yung mga batang talaga namang dumidede sa kanilang nanay ay mas malusog at mas masigla. So, breastfeeding may make child smarter. Just like what I have told you earlier, na yung mga bata nga po na dumidede sa kanilang nanay from birth up to 6 months ay mas mataas yung kanilang mga IQ scores in later childhood. So breastfeeding may help lose weight. Ayan. Breastfeeding helps the uterus contract. Ayan. So mothers who breastfeed have a low risk of depression. So yung mga nanay na nanganak right after giving birth, ayan, magpa-breastfeed lang kayo sa mga sanggol to reduce or to lower the risk of depression. Breastfeeding reduces your disease risk, and breastfeeding may prevent menstruation. Ayan, it also saves time and money. Syempre, hindi ka na bumibili ng mga formula milk kasi nga meron ka ng ready-made milk na ibibigay or ipapasuso na lang sa bata. So, those are the 11 benefits of breastfeeding for both mom and baby. Alright? Alright, thanks for listening and have a nice day.